Professor MP Sachdeva sir to give a welcome address, sir. Over to you, sir.
Very good afternoon to one and all present here in the virtual mode. Thank you for your joining us at the valedictory function of the two-day national seminar on Anthropology of Health and Wellbeing, being organized in honor of Professor P.C. Joshi, our esteemed colleague, former head of the department, and now the Vice Chancellor of the University of Delhi. Thank you, Professor Joshi, for your kind presence. I, on behalf of the Department of Anthropology, University of Delhi, welcome you all. It is my profound privilege and honor to welcome the chief guest, Professor Deepak Kumar Behra. Professor Behra is currently the Vice Chancellor of Kalinga University, Kalinga Institute of Social Sciences, Bhubaneswar, a deemed to be university, and President of the UIAF. Before this, he has been the Vice Chancellor of Sambalpur University, Rajendra University, and Berhampur University. His distinguished career has many national and international honors. To name just a few, he was Fulbright Visiting Fellow, California State University, Dart Visiting Guest Professor, University of Tübingen, Germany, Carlos Chagos National Foundation Research Fellow, Brazil, National Research Foundation Fellow, South Africa, European Union SISCA Fellow, Indo-French Academic Exchange Fellow, Indo-Israel Cultural and Educational Exchange Fellow. He is also the Sarat Chandra Roy Memorial Gold Medal awardee from Asiatic Society, Kolkata. He is the chairman of the IUAES Commission on Anthropology of Children, Youth and Childhood, and former member of Governing Council, Association of Indian Universities. Professor Behra is the author of 130 research publications and 19 books in the field of tribal studies, children, and childhood. He has visited more than 30 countries on different academic assignments. Thank you, sir, for your presence. I also have the honor of welcoming Professor Alok Kumar Kalla, our guest of honor today, a stalwart in anthropology, a former professor and head of our department, and Dean Faculty of Science. Professor Kalla is known for his pioneering work on Kashmiri Pandits, skin reflectance studies, and his umpteen number of collaborative research projects with Professor Frederick Vogel, Germany. It is a matter of immense pleasure for me to welcome our special guest, Professor I.S. Marwa, a former colleague of mine, benevolent friend to all, and one of the best teachers of my department. He is known for his exemplary memory and hold on socio-cultural anthropology. Both Professor Marwa and Professor Kalla have been the teachers to Professor Joshi, and he has a lot of affection and respect for them. I also extend my heartiest welcome to all the dignitaries, my present and past colleagues from the department, and all the participants. One drawback of the virtual participation is that all the participants are not visible on the screen. Believe me, I thank and welcome you all. It is past 4 p.m. today, and we are coming close to the culmination of a wonderful experience. The hosting of this two-day seminar has been a very satisfying experience for all of us. I am proud of my department and my energetic colleagues, dynamic research scholars, and supporting staff. I do hope and believe that you will also agree with me. I once again thank you for your gracious presence. Thank you. Thank you, sir.
Thank you so much, sir. Now, I request Professor R.P. Mitra, co-convener of the seminar. Kindly give your co-convener remarks, sir. Over to you, sir.
Thank you so much, Dr. Kiran. Honorable Sir, P.C. Joshi, sir, our chief guest, Honorable Professor Behra, our guest of honor today, and my teachers, Professor Kalla and Professor Marwa, our head of the department, Professor MP Sachdeva, other dignitaries, senior professors who are joining us in this culmination of two-day seminar on health and well-being, my colleagues, other dignitaries from other universities who are joining us for this program, and dear students. This seminar is a unique seminar. It's a unique seminar, not only for the reason that it is in celebration of the contribution which Professor Joshi has made to the discipline of medical anthropology, and especially to the concept of health and well-being. It is also special with respect to that this is perhaps among the very few seminars where the papers have already appeared in the form of a book before they are being presented here in the seminar. So the success of the seminar was written before the seminar was to be held. Now, having said this, I will be talking about three things. First, I will be talking about, give you a brief idea about the genesis of this seminar, how we arrived at the topic. Second, I will be talking about what goal we set in this seminar. And third, I would be briefly talking about what our final uptake from this seminar has been. Now, starting from how the genesis of the seminar happened. Well, genesis of the seminar, there were two reasons. The first was, of course, we wanted to honor Joshi sir. And when we thought about honoring Joshi sir, we thought about, of all the contributions which Joshi sir has made, one of the most important contribution has been in the field of health. So the topic was chosen by itself. But topic was chosen by itself does not mean that we decided to choose this topic. We decided to hold a seminar on this topic only for this reason. There was another reason for which we decided to hold this seminar. And of course, you know this reason. And you know this reason is the present discourse, the present point of debate, the present point of our whole thinking, that is the COVID. Now, the second point was with respect to COVID. Now, when we talk about COVID, there are two things which comes to, there's only one thing that comes to our mind, not two things, one thing. And that one thing happens to be what we call as something which has never happened before, unprecedented. Now, our whole idea originated in a debate which happened in Madam Saraswati's room. Then we moved to our head's room with this idea. And in fact, Madam Saraswati and Dr. Mahajan, they were the key players, along with Professor M.P. Sachdeva and the convener of this seminar, Professor Mondol, that we decided to deconstruct this idea of unprecedented about the phenomenon. And when we were talking about this unprecedented nature of this problem, the most important striking thing which emerged when we held a brainstorming session, if you remember, Sachdeva sir, in your room, the whole idea of the differential impact of this disease. You know, this disease, it has caused havoc. There are many who were considered healthy among us who succumbed to it. There were people who remain what we call medically unsymptomatic, but still able to carry the disease. And third, there were people like me and my three other colleagues, including Professor M.P. Sachdeva, N.K. Saraswati, and Professor Manoj. We escaped with what is called as the mild form of this disease. Now, this kind of a differential impact was a matter of discussion between us, because this for the first time made us rethink over the concept of body, biology, immunity, and disease. Now, once we had these four key terms on the table, we fell back upon a theoretical perspective which was given by Joshi sir. Joshi sir, in his medical anthropology, has tried to combine two things together. He has brought two different approaches at one place. The first approach, what we call as a critical understanding. And the second approach which Joshi sir brought on the table was that medical anthropology at the end of the day is a deliverable science. It's an applied science. It's a science which has to give answers to the problems which human beings face with respect to health and illness. With this approach in hand, our task was very clear-cut. We had to answer two things, and these were the two key questions with which we decided to hold this seminar. We decided to hold this academic brain churning, this academic exercise. The first was from the critical perspective of Joshi sir, and with the idea of COVID in our mind and the unprecedented nature and the challenge to the understanding of health, we wanted to see whether we need a different understanding of the concept of health during the time of COVID or during the post-COVID time. Do we need a different perspective towards health? And second thing, along with the health, we also wanted to see what has to be the response, what has to be probable, the solution of the problems which we are facing. With these two key points in our mind, we sat down to plan this seminar. Now, what has been the answer to these problems which we had set in this seminar? Now, this seminar was unique from third perspective. The third perspective the seminar was unique is because almost all the contributors, except for few, are direct protege student of Joshi sir. So there were these multiple Professor Joshi's mind working on this problem. And there were few who were very close to Joshi sir who came to participate in the seminar. Now, many 25 papers, 26 papers were read in this seminar covering diverse topics, all focusing upon the central idea of health and well-being in different perspectives. Now, if we see these papers, if we have heard this paper, most of these papers tried to move on from the traditional conception of health pre-COVID time, health as something which is either seen in terms of social, psychological, and physical well-being, and absence of disease. Now, if you look at these papers, it talks about that health is something which is beyond these two ideas which has guided our understanding of health and our policy of health for all. And it was felt in all these submissions that when we are talking about health, although these three factors of well-being, they are of important consequences, but there is something which goes beyond this. And it all started yesterday with Joshi sir's elaboration of the concept of well-being. Let me now try to put it together. Now, we expounded this idea, these three ideas, that just they are not enough in the post-COVID time. We need to take into consideration that we are not the sole animal who is occupying this space. We don't live in a zoological vacuum. We live in conjunction with other animates being. So therefore, the biological diversity and the health of the biological diversity is also a significant determinant, as Lancet pointed out. We felt this very strongly in the seminar. Many people talked about ecology and health relationship. So we need to expand our conception. The second thing which we found was that people were talking about not just about the animate objects and human relationship with the animate world in the conception of well-being and health. They were also talking about inanimate aspect of the health. And when they talked about inanimate concept of the health, what they were drawing their attention to, their pointer was towards the health of this planet as an energy system. A healthy energy system and a healthy biocultural diversity is essential for the health of individual. Second thing with respect to health was, we don't have to confine our understanding of health to merely absence of disease. As I said earlier, again, we took a pointer from Joshi sir's paper, the concept of functional sufferings as it is evident in many communities, where suffering resets relationship of individual, of society, of community with their surroundings. Now, the second important finding has been that we have to move beyond the concept of normal and pathological when we are talking about health. More than the normal and pathological, health is all about adaptiveness. How individuals, how communities adapt. So what is health? We are coming very close to how WHO has been thinking, Lancet has been thinking, which has been shown in all these papers, that health is adaptation. Now, this has a very important consequences for public health. Now, here we move to the second important pointer of Joshi sir's ideas. That in this seminar, number of papers dealt with this idea of how do we put this idea of health as an adaptive state to public health policies. Now, this is very significant. It is very significant because in the post-COVID time, our own reactions, our strategies, our policies will be determined by how we are able to put this into practice. And what it means is a differential way in which we approach our health policy. It is differential in two ways. And I come to the last part, that how it is going to be impactful. It is important in two ways because it would change the relationship of individual with doctors. Earlier, health was something which was understood, defined, measured, treated by doctors. Now, health, when we look at it as a state of adaptation, it would imply it is the people who would define their need. What is health to me will be different from what is health to you. This polylytics of health, this differential conception of health from differential conception of symptoms has been one of the important achievement of this seminar. And what it means is, now the roles of the doctors would be enabling us to fulfill our differential needs of health. The second important impact of our seminar would be, many papers has emphasized we have to move towards an integrative medical care system. Biomedicine by itself perhaps may not be able to fulfill all these needs. We have been asserting, medical anthropologists have been asserting from time immemorial, right from the beginning, that the traditional healers can play an important role. Now is the time how we can really put them together. So there is a need for change in nomenclature as proposed by WHO. We have to move towards an integrative healthcare system, as pointed out by Joshi sir in his initial remark. With this, I rest my case and I invite our co-convener, Dr. Chakravarti Mahajan, to talk about what all went on in this seminar. Thank you so much for giving me such a patience hearing.
Thank you so much. Now I think it's over to you, Dr. Mahajan.
Thank you, Dr. Kiran. Thank you, Professor Mitra. I think Professor Mitra has already covered a lot of what happened during the seminar. In fact, what he did not mention is that this work is a pure labor of love. And I mean, we immensely, this book brought immense joy and learning into our lives. Last 3 months have been very, very special. So Professor Joshi, who's our poster boy today, Professor Behra, chief guest, Professor Kalla, guest of honor, Professor Marwa, who's special guest today, Professor Sajdev, Professor Mitra, all our guests, friends, students, ladies and gentlemen. This seminar was organized in honor of Professor Joshi on the occasion of his superannuation from the department. Professor Joshi is a pioneer in the field of medical anthropology. In the last 4.5 decades of his academic career, he has significantly contributed to the subdiscipline in terms of theory, methodology, and practice. The subject of understanding health from people's perspective has remained central to Professor Joshi's academic career. He has examined conceptions of health and illness in communities across North India. Professor Joshi has shown through his work that health and illness are complex ideas imbued with social and cultural meanings. With an objective of understanding various dimensions of health and well-being, and to engage with Professor Joshi's ideas and published work, we invited some of the finest anthropologists, including his long-standing peers, colleagues, and students from all over the country. The pre-circulated papers broadly covered broad areas in medical anthropology, including sociocultural and biological perspectives about health, disease, disability, and disasters. The issues discussed relate to the health systems as provider systems and access to healthcare, health attitudes and practices related to biomedicines, ISMs, and folk medicine, public health and epidemiology connected to natural disasters and pandemics, biomedical issues in the realm of genetics and molecular anthropology, and genetic disorders as a challenge to community acceptance and management. We organized these papers into 6 themes and thus 6 sessions for the seminar. A total of 28 papers were presented during the seminar. And since, if I summarize all the papers, that will take a lot of time, but I just want to briefly tell you about, the themes. So we had themes like indigenous health and medicine, where people discussed about healing practices, ethnomedical systems among various communities. We also had a paper on dark side of indigenous medicines. We had work, Professor Mitra's paper, which discussed Professor Joshi's work. Then there was another theme on health, disease, and health-seeking behavior, physical health and well-being, women's health and well-being. Also, there was a section about coronavirus pandemic and how it is unfolding in the present context. And we had a rich, very, very rich discussion in all the 6 panels which we witnessed ourselves. So I'm sure, and on the behalf of organizing committee as well as the editorial committee of this Festschrift, we are quite sure, and Professor Mitra has already told you about the spirit of the book, and we are sure that this exercise will bring fresh ideas for the advancement of theory and practice in Indian medical anthropology. This is an important book, and we request you all to procure a copy when the book is out in market. Thank you very much.
Thank you, Dr. Mahajan. Now I would like to request Professor A.K. Kalla. I know that the introduction was already given by our sir, Professor M.P. Sachdeva, but still I would like to honor and take a privilege to introducing him again, since he is our mentor. In fact, a grand mentor, my mentor, so it's a grand mentor. So I would like to take an opportunity to introduce Professor A.K. Kalla. And Professor A.K. Kalla, he's a very renowned anthropologist. His expertise is on physical anthropology. And during my PhD and master's, I learned a lot from him during the writing of the thesis, starting from the data collection, field work, and his expertise is unlimited. He has the total knowledge of all the physical anthropology, at the same time demography, and his expertise from fertility to mortality, peopling of India, racial classification, and all the aspect domains of physical anthropology. Sir, I'm very happy to introduce you, sir, and thank you so much for coming, sir, and over to you, sir.
Thank you very much. It's indeed my pleasure to be guest of honor here. And I'm so happy that I have my friend, my senior colleague, Professor Marwa, here with me. And also Professor Behra, who is chairing who is a chief guest here. It's my pleasure to be guest of honor here in this seminar over here, which is being held for honoring my dear colleague, Professor P.C. Joshi, who has been one of my dear students also. Joshi has been a very shy student, but he has been a very hardworking person. And he's always ready to take up a challenging task. You see, when long back, when I was in the selection committee for him in IVAS, I had big expectations from him. He did very well over there. And after selecting him there, I told their director, Professor Bapna, that I am giving him this young man only for 5 years. And after 5 years, I'll take him away. Because I had my own calculation. I had already set my eye on him. Because in Garhwal, he was single-handedly teaching all the subjects of anthropology. Can you believe it? Now, this really impressed me a lot. I said, what hardworking person is he for teaching all the different disciplines, different subjects in anthropology? It's no easy job. It's tremendous task needed, tremendous commitment needed, hard work needed. And if he could do single-handedly over there, he would do really miracles if he comes to our department. And I knew that after 5 years, I would be in the chair, and I set my eye on him right there. And it so happened that there was a position also which fell vacant. I had my calculation, and we selected him. And after this over here, of course, he really proved himself more than what I expected. My first experience was when I organized, when the department organized a seminar on tribal health, and he was the co-convener for it. As a fact, he was almost the chief person for it, because health was his cup of tea, and he had suggested it, and we organized a seminar. And let me tell Dr. Mitra that that was one of the first, or maybe the first seminar we had organized with Dr. Basin earlier, which we had published before that seminar I had. And this was the second seminar in which the book was published before the seminar was held. And it was released on the very first day with all the papers. And I'm happy that Sajeva has kept up this tradition, because otherwise, seminars, papers read, taken read, and they go unnoticed unless they are published. And if they are published in one volume, this is really indeed a great task. It's a hard task. And Joshi had done this hard work himself, and for preparing that, publication for a seminar on tribal health, which was published on the very first day and released on the first day. So from there also, and then he was a man who was so much interested in audio-visual anthropology. As a fact, most seriously, he borrowed a camera for that purpose from the department. And I procured it for him because it was difficult to get it from somewhere. Anyway, I procured it for him. And he continued that. And after that, I could really see many of the films being made by him. And in his room, where he used to be, displaying it on the whatever he made. After my retirement, I saw it when I used to go there. And I was very happy that here's a man who was not misused or who was just not taking it for the fed of it. He used it very thoroughly, properly. So, and he should be a source of inspiration to all the young generations, younger people. To his students, he must have been. And I've been seeing that how nicely he has trained many of his students in the field. Whenever, after retirement, whenever I used to go there, we used to have lunch there. Saideva, Saraswati, myself, and Joshi. And maybe once in a month, I used to go there till 2 years ago. And I used to find his students coming out with something or the other, some or other new film. Now, so this is what Dr. Joshi is. And this seminar is indeed a very befitting seminar in his honor. And I'm glad that all the papers have already been published and they are being released already. Dr. Joshi, his commitment, particularly to the study of indigenous medicine, is there. And whenever he used to discuss with me, he used to talk about that. So I'm sure that field, he has drawn attention of the world, is indeed many others may be indulging in that. But then, yet another aspect of his. In disaster management, for the international body for the disaster management, I'm happy that he's a member there and he has contributed. And he'd gone to a number of conferences on this abroad. Once he went with Dr. Veena Srivastava also. And he is a multifaceted personality. Very amusing person, very witty. And but at the same time, he's a very respectful person, highly respectful. I'm really very proud of him. I wish him all the very best. God bless him. Thank you.
Thank you so much, sir. Now I would like to introduce Professor I.S. Marwa, sir, another mentor, a social anthropologist, and a great field worker. And he is one of the renowned social anthropologists, and it's always pleasure to hear from you, sir. So over to you, sir. Sir, you have to unmute, sir. Sir, you are not audible, sir. So we are not able to hear you, sir.
Dr. Kiran, I'm trying to contact sir. Give me just 1 second.
Yes, yes, sir. Yes, sir. So you can request him to use earpiece or something. Maybe the microphone is not working.
Sir, we can still hear you. Marwa, sir, you are still muted. On your left-hand corner, sir, please see a sign of a microphone. Click over there. Marva sir, can you hear me?
No, that he has done, but still there is a problem.
I think so.
I think, sir,
Proceed with
Sir, please rejoin, and I think sir audio is not working. That's why sir can join again, and maybe it will work.
Sir, try to rejoin.
Mitra sir, call him and tell, leave the meeting and rejoin.
I have talked to Professor Mrs. Marva also, and she will be helping me.
Kiran, shall we proceed with the program?
Should we go ahead with the program, or should we wait for one?
Yes, whenever Marva sir can join, we can continue. We can ask him to say something. Now we should proceed.
So now I would like to request Professor Deepak Kumar Behra. Sir is presently a Vice Chancellor of KIS deemed to be University, Bhubaneswar, Odisha. And sir is very renowned social anthropologist, has a lot of publication, and our head of the department already briefed the bio notes of sir. So without further delay, I would like to request sir to deliver us this. Sir, over to you, sir.
Thank you very much, Dr. Kiran Mala. Am I audible?
Yes, sir. You are very
Yes.
much audible.
Yeah. Good afternoon, one and all, and Honorable Professor P.C. Joshi. The main attraction of this entire webinar, even the valedictory session, esteemed guest of honor, Professor Kallaji, and revered special guest, Professor Marwaji. I'm sure he will be able to join us after some time. Our beloved head of the department, Professor Sachdeva, convener, Professor Mandal, organizing secretary, Professor Saraswati, Professor Mitra, Dr. Mahajan, Professor Singh, Dr. Gupta, Dr. Yadav, Dr. Anatoli, Dr. Singh, Dr. Kiran Mala, and all other faculty members, student, research scholar, alumni of the Department of Anthropology, University of Delhi, paper presenters, chair, senior professor colleagues from different parts of India, representatives of press and electronic media, and ladies and gentlemen. So at the outset, I would like to extend my heartfelt thanks to Professor Sachdeva, Professor Saraswati, Professor Mandal, and the whole department for giving me this privilege to grace the valedictory function as the chief guest. As you all know, this webinar is being organized by the Department of Anthropology, Delhi University, in honor of Professor P.C. Joshi, the Honorable Acting Vice Chancellor of Delhi University. I would like to congratulate the department for organizing such a wonderful webinar and bringing out a felicitation volume in his honor right in time. This is the best tribute that can be offered by a department to a fellow colleague at the time of his superannuation. So congratulations to one and all. In fact, my meaningful interaction with Professor Joshi began only in the year 2013, if I correctly remember, when I was bringing out a fellowship in honor of my research partner, Professor Georg Pfeffer, from Free University of Berlin. Actually, I was then attached to the Department of Social Anthropology, Tübingen University, Germany, as a DAD visiting guest professor. And it was the 9th volume of the series Contemporary Society Tribal Study with the subtitle Health in the Context of Tribal Culture. And I requested Professor Joshi to contribute a chapter to the volume via mail. I sent that mail from Tübingen, and he readily agreed and finally contributed a chapter titled Anthropological Perspective on Traditional Healing Practices Among Indian Scheduled Tribes to that volume. And that volume was also published by the Concept Publishing Company, New Delhi. Since then, I have been in touch with Professor Joshi, and in recent time, he has been one of the active members of United Indian Anthropology Forum. In fact, Keys University, where I am presently serving as the Vice Chancellor, will will organize the World Anthropology Congress 2023, partnering with the UIAF, and in collaboration with the Department of Anthropology, University of Delhi, Department of Anthropology, Utkal University, and Department of Anthropology, Sambalpur University. Therefore, I would like to extend my heartfelt thanks to the Department of Anthropology, University of Delhi, for agreeing to lend unconditional support and collaborate with KIS for organizing the WSC 2023. Well, I have been following this webinar since yesterday morning, not continuously. As rightly said by Dr. Mahajan, other than the inaugural session, this webinar had 6 technical sessions wherein 28 papers were already presented by eminent scholar. I'm not going to detail. And, look at the changing scenario. We are slowly getting used to the kind of online platform which was even unheard in the recent past. Many of our senior colleagues are still struggling hard to get used to this online platform. And right now that happened to Professor Marwa. Department of Anthropology, Delhi University needs to be congratulated as they are one step ahead, and they are organizing this webinar on a blended mode. I will divide my small presentation into 3 parts. I will speak first a little bit on my understanding with a prefix poor understanding on health, illness, and health system as a social anthropologist. That's not my cup of tea. Still, I will try to venture to that area. Then I will switch over to one major health issue that we have been facing and fighting during the past 1.5 years. That is novel coronavirus, the theme of the last technical session. And finally, I will touch upon some of the special quality of the great personality on whose honor we are organizing this online webinar. I will not take more than 10-15 minutes. We have been hearing to different presentation on health, illness, healthcare system since yesterday. So I'm talking about my poor understanding. Please correct me if I'm wrong. When a person is sick, various levels of culture always influence what is thought to be the cause, what remedies will be sought, in what order, through what institution, and with what expectation, and with what participation by others. This doesn't mean that all members of a local culture respond to the same way to an illness. A healthcare system is complex. We all understand that. And that therefore it allows for many possible choices and action and way to reject failed methods. A healthcare system, like other cultural system, integrates the health-related components of society. These includes patterns of belief about causes of illness, governing choices and evaluation of treatment, etc. Illness, as we all know, lowers one's working ability, reduces poverty, income, saving, and leads to poor quality of life, thus perpetuating poverty. Therefore, health and treatment are closely interrelated with cultural environment, particularly among various indigenous community living in remote area. Therefore, a medical system is that which represents a total cultural organization of medically relevant experiences and an integrated system of social perception. Therefore, healthcare system is a system of symbolic meaning anchored in particular arrangements of social institution and patterns of interpersonal interaction. This is my novice understanding of health, illness, and healthcare system from a cultural perspective. Let me switch over to the second part, that is the pandemic COVID-19. And we have been fighting with the deadly COVID for past 1.5 years. The whole world has undergone a period of turbulence. So we know that. We need to assess the kind of impact of COVID-19 on various aspects of human society. Sometime back, Professor Mitra rightly pointing out the differential impact of COVID-19 on different individuals. This is a matter of discussion. This should be discussed at length by anthropologists. And December 2019 will be remembered by people across the globe for identification of the leakage of this virus. We know how COVID was discovered and leaked from a Chinese lab, and how there was blame and counter blame, how US and other countries blamed China, and in return how China blamed US. We know that, mud throwing game. And this disease, this COVID-19 spreaded over lightning speed. And then the concept of healthy family of nation suddenly turned into sick family of nation. And as on 25th May, I'm quoting some figure, 34 millions found positive in US, 53 millions in Europe, 30 millions in South Asia. And now the question is that being a developed nation, why does America have so many positive cases? And why that is not the case with China? How could China be able to control it? And why other nations failed? These are some of the questions that should be answered by, medical anthropologists, especially anthropologists can a big role. And we have to focus on the meniscus of the problem. As anthropologists, we can lead from the front and can become pathfinder by providing lasting solution to the whole mankind. I think COVID-19 is going to leave a lasting impact on the society, at least for next 50 years, quote unquote. Now the whole world is, going to see a pre-COVID period and post-COVID period with a COVID in between. And in fact, we have already seen two. We are going to see the third one soon. In the post-COVID period, there will be huge change in the power equation. Lockdown has now become new device to control the pandemic. It initially appeared to be a tangible solution. This was advocated by the Western world for the developing countries, including India. But what happened eventually? Economic shutdown led to standstill of all economic activities. And it led to economic collapse of various nations. And as you know, many countries have now witnessed minus 20 GDP growth. Can you believe minus 20 GDP growth? The impact is felt more by developing nations where majority of the people are in the unorganized sector like India. So government came under severe pressure and criticism. Now, there is a very difficult choice of saving life of the people and saving their livelihood. So this is a difficult choice, and many government, including Government of India, is struggling to take a call on this matter. We all know that the COVID-19 impacted migrant, how the COVID-19 has impacted migrant laborers, women, elderly population. The second surge has not even spared the younger generation. We see so many young people are dying, even within our anthropological fraternity. So this is time to develop and adopt a robust health crisis management system in India in a noble way, probably. So, because COVID, I would say, is notorious for large number of deaths. India has already, witnessed nearly 2.25 lakhs death. The actual figure may be many more, as we know, that's not the real figure. There are many predictions on the cause of the Third World War. People were speculating and saying the main prediction were that it could be due to dispute of national boundaries or border. It could be due to sharing of water. It could be due to religious differences. But now, instead of a third world war, we are suddenly witnessing a global war. People of all nations are fighting together relentlessly against a virus in this global war. The virus has already destroyed the social fabric and harmony of human society. We are still groping in dark with our limited resources to fight this global war against the pandemic COVID. This time we are not fighting this war, this new global war with gun, artillery, tank, missile, but with sanitizer, soap, mask, and social distancing. Our common enemy is invisible, but it is a deadly silent killer. That is now there is a new spirit of globalization that is emerging. Mutually assured survival, quote unquote, mutually assured survival. If other countries survive, we'll survive. If everyone is safe, I am safe. And that is the message. New kind of global health governance is now in place. Now different nations, they are sharing equipments, technology, vaccine with each other, one another. This is a new kind of global order. The bitter truth of today's COVID time nicely turned into a joke. Today morning, I have posted somewhere, which I would like to share with you, because this is the fag end of the day. So there should be some refreshment. A teacher asked one of his students, what is the difference between arts, science, and commerce? The smart student took a pause and then replied, sir, there is no medicine of corona as of now. That is science. Hospital bill comes in lakh, even there is no medicine. That is an art. And patient dies, but hospital survive. That is commerce. Hope you'll admire this innovative thinking of that student. Let me now move on to the third part of my presentation. I would like to highlight some special quality of Professor Joshi, on whose honor we are organizing this webinar. I am not going to present before you his long list of achievement and publication. Professor Mitra has already made a presentation on that in the first technical session, and his student will speak about him as a good teacher. I will present before you what I have seen him as a down-to-earth person and as a sublime personality. What has not been touched upon in this webinar, and what I see in him as an academic administrator. Professor P.C. Joshi is a charismatic leader and able administrator. A successful administrator needs to be a charismatic leader, a leader who leads by example and leads from the front, enthusiastic, reliable, amicable, determined, ready to learn from his followers and even from his or her mistake, a person who is honest, focused, respectful. Professor Kalla was using this term, respectful, patient, loyal, courageous, optimistic. When I say optimistic, it is with positive thinking, open-minded, with sense of humor, confident, and committed. So these are the qualities of a true leader. Actually, I noticed all these qualities in Professor Joshi. Therefore, Professor P.C. Joshi is not only a charismatic leader, but also an able and successful administrator. Professor Joshi, this is what I have seen you, and that is what I wanted to present before the August House.
So well said, Dr. Behra.
Thank you very much. And the other aspect, I've seen Professor Joshi as a wonderful innovator. Okay, so an innovator must possess some special quality, and an innovator is one who does things differently, tries to move away from the conventional method, has inherent curiosity, and has infectious passion that fuels the innovative fire, the courage to keep fighting, challenge and ignite student mind, and use his network to mobilize resources. When I examine his personality trait, I notice all this quality in Professor Joshi. Therefore, he is a wonderful innovator, and a wonderful innovator can only provide real leadership to an institution of higher learning. Professor Joshi is a successful administrator because he's a charismatic leader and a wonderful innovator. Namaskar, Professor Joshi. And Professor Joshi is not going to retire so soon. Believe me. So, if you are thinking like that, that is your misconception. Of course, in a lighter vein, believe me, then you have to bid him farewell again and again and again. Please note this. I am not joking. I am not kidding. I'm speaking from my heart. And he is now the acting vice chancellor. He will stay connected with the department for many more years. Professor Joshi, during his, address in the inaugural session, which I attended, somewhere in passing said, this 1 acre of land where the department is located, where I stand, has given me so much that I would never be able to repay back during my lifetime, quote unquote. And that same department has now made him acting vice chancellor. The faculty of the department and we, all your colleagues across India, would like to see you in the same position, sir, without a prefix acting to your present designation. All the best, Professor Joshi. We are proud of you as you are one of the torchbearers of Indian anthropological fraternity. Thanks everyone for your patience hearing. Namaskar.
Very well said, sir, from all of us. I think so.
Thank you so much, sir. Now can I check whether Marwa sir is back online?
I'm here.
Okay, sir. Over to you, sir, then.
But do you hear me?
Yes, sir. Yes, sir.
See, I had to come to the dining table to talk. Something went wrong with the main gadget. Anyway, I'm so sorry for all that. It's wonderful to listen to Dr. Professor Behra. It is wonderful to have listened to Professor Kalla. And first of all, it was very nice to listen to all the seminar held for last 2 days. I made it a point to sit down all through and listen to the beautiful essays written by, articles written by students. So one thing is very clear. If the students of our department are so capable as they have written and which I have listened to, then there is nothing to worry for anthropology and nothing to worry for the Department of Anthropology. It gives me a great pleasure to say that the founders of the Department of Anthropology, starting with Professor P.C. Biswas, Professor Mehra, Professor I.P. Singh, Professor Dr. Sharma, and many others who contributed to the making of department, their soul must be very happy if they have the power to listen to what has been happening for the last 2 days. So it gives me a great pleasure to announce that even I feel very proud in whatever little contribution I've made to the functioning of the department and the functioning of the teaching department. I'm very thankful for being invited to this webinar, and especially I'm thankful to Dr. Saraswati. Professor Saraswati has become expert in organizing seminars and organizing webinars. So my humble tribute to Professor Saraswati, you have really made a very beautiful contribution to the functioning of the department. Now, after having listened to a large number of presentations, I come to the conclusion that we have all kinds of functioning of the anthropology. On one hand, we had presentation on a Naga village by Avitoli, where she talked of the bone healer. On the other hand, we had presentation by others who talked, especially by Dr. Sharma, who talked of the wider level of what was happening to the environment and various viewpoints about the development. Anthropology traditionally has been known to be working on small scale communities. Even now, when I talk to the people and they think anthropology means only tribal people. So that is the general impression. Whatever we have been taught is also that anthropology deals with communities and culture in a holistic manner. That is a very strong attribute of anthropology, integration of various elements into a whole. Secondly, anthropology is known for working on empirical situation, but going into the qualitative dimension, going beyond what is visible. That is a very important qualification of anthropology contribution. And thirdly, that we work on small scale communities. It is true that we have been working on small scale communities, but we have also been linking up small scale communities with the wider world. For instance, it was the anthropologists way back in the 30s who talked of folk-urban continuing. That is, there is no contradiction between the small-scale community and a larger whole of which it is a part. And it is quite evident now when during this COVID situation, we found a large number of persons who are migrant laborers, known as migrant laborers, moving back to the villages. That means we have to reassess our basic idea of a village as a small scale community and an urban center. There is a direct correlation between the two, which was quite evident during the migration and remigration. So I think anthropologists also need to rework, and thanks to the situation, COVID situation, we have to rethink about it. On the other hand, we find that a large number of papers have been written, though there is, of course, we have to come to Professor. This seminar is held in honor of Professor P.C. Joshi. I have always called him as PC ever since we have become colleagues in the department. He was a very, very amiable person. And as a student, I don't remember ever anything which was not very amiable in Joshi. As a matter of fact, I don't even recollect what kind of student he was. The only thing I recollect is that I have a small contribution to the field work he conducted, and later on did his PhD, MPhil, and main work on the same community, that is the Khasa, popularly known as polyandrous, but had been called as polygynandry or polygynandrous community by Majumdar, Professor Majumdar. So in a small way, I have talked about his my impression of his field experience, my impression of how he conducted the field work, and a little spark I saw at that time in that young boy at the age of, I think, about 19 or 20, around that time, age of 19. P.C. Joshi has made a contribution to medical anthropology, and to be very frank, I was not very conscious of what he had been doing. All I knew was that he was interested in medical anthropology, and that he was doing very well in medical anthropology. He was known not only in India but in other countries also as an expert on medical anthropology. But I didn't know that he had such a vision, such a vast vision of the subject, which was evident only on the basis of the papers which I heard in the webinar, because there were papers ranging from one dimension to another. So I find that Professor Joshi has already made an impact on the functioning of the department, on the academic side of the department, and that is his great contribution. There are other dimensions of Joshi. As a friend, it's very difficult to talk about friend, but he has been a very kind person, always willing to entertain. Whenever I went to his department, straight away we used to go to his room. And so I wish Professor Joshi a long life, a very colorful experience, and very successful stint as a vice chancellor, which, as Professor Behra has announced and indicated, that he will be becoming vice chancellor very soon. That is the wish of not only our department, our students, but also all his friends all over, and also of the university community, because whatever little we find he has done so far is really very beneficial, not only for the department, but also for the university. Now, with these few words, I wish Professor P.C. Joshi a very successful career, a very good life, though this is the first retirement at the age of 65. But this is not really a final retirement, as Professor Behra has said. So my best wishes to Professor Joshi for very wonderful and successful career ahead and contribution he can make. Thank you so much.
Thank you so much, sir, for your wonderful speech. And now, most important speaker of the whole seminar, our beloved teacher and mentor, the renowned anthropologist, Vice Chancellor of University of Delhi. Now I would like to request our sir, Professor P.C. Joshi, to deliver her speech. Over to you, sir.
Okay, am I audible?
Yes, sir.
Okay. So, first of all, thank you very much. I don't know, I feel highly pampered today because I don't know. Before I start, I'll say, I was wondering why we have a record-breaking person in Professor Behra, who has been Vice Chancellor in 4 places. After listening to him, especially after he describing me, I understand why he had become Vice Chancellor for so many times. I think a record-breaking Vice Chancellor. But I would like to start by my teachers, Professor Kalla and Professor Marwa, who actually have contributed a lot, and they have been my respected teachers. Then I have, I think, very, student of my time. I could see Professor Lalit, Dr. Lalit Kumar and Naresh Vaid are there. And from outside the department, Abhi Ghosh, Mitashri Mitraji, and Sri Venkat Rao ji, are there. My own students are there, and I've been listening to them. Hemlata, Dr. Mir, Dr. Kalandi, Dr. Sonia Kausal, Dr. Aribam, and I could see R.L. Fatima as well. So many of them. And then, of course, people from the department, starting with Professor MP Sachdeva, Professor Saraswati, and Professor P.R. Mondal, Dr. Chakravarti, Professor R.P. Mitra, Kiran Mala, Nikashri Mitra, and all. And I think a lot of students who have been here. Now, I have to speak tomorrow also. So today I'll restrict myself to the seminar, I think, the academic aspect of it. And I'll leave out the personality aspects, maybe that I'll take up tomorrow. Now, I would like to start by listening to Mitra Sahab. Mitra Sahab spoke today, Mitra Sahab spoke yesterday. And I think he has really impressed me a lot. And I think the future of medical anthropology in this department of Anthropology, University of Delhi, is secured with Mitra Sahab and Chakravarti Mahajan at the helm of affairs. And I think there are a lot of new exciting researches are going to come up from this department, especially after I listened to Suniti Yadav and her presentation. So I was listening, like I was not coming to Zoom since yesterday, but I was listening to all of you so that you don't become conscious. I was on the YouTube, and I was listening to all of you on the YouTube, and really enjoyed these 2 days deliberations that were there. Now, so after that, I would like to know, yesterday I talked about that long back we realized that health is not mere absence of disease. Today, I would like to start by saying that healing is not mere taking of medicines. And I like to start from there, that healing is not mere taking of medicine, whether it is in Ayurvedic medicine or allopathic medicine or homeopathic medicine. Healing is much, much more than taking of medicine. And who else but anthropologists, as I said yesterday, are in a better position to appreciate, realize, understand, and make note of this very fact that healing is not mere taking of medicines. Now, and in the field of medical anthropology, there have been a lot of studies done on health-seeking behavior. In fact, under me, there have been 2 PhDs on health-seeking behavior. And anyone who is a student of medical anthropology knows that health-seeking behavior is something that is so dear to behavioral sciences, including anthropology. Anthropologists have been doing it from very, very long time. And there was a very famous, long back famous paper by Harold Gould on who chooses, I think not Harold Gould, but I think paper by T.N. Madan, who chooses modern medicine and why, appeared in EPW 1969. So health-seeking behavior is something that anthropologists have been interested in. We are interested in why people go to a particular kind of a healing tradition. And of course, when we are studying in a village, people are going to different kinds of healers and different kind of healing choices that they are making. We are interested in why people are going to different kind of healing traditions. And I think a time has come where I think we have to slightly shift the focus of our studies on health-seeking behavior, where we should try to understand from the patient point of view, from the patient perspective, what are the outcomes when people are seeking different healing traditions or healing alternatives? What are the outcomes? Now, I think we have only restricted ourselves to why people are making choice, but we have not perhaps given consideration to the fact what has been the outcome of going to a particular healing tradition. I'll give you a very simple example, and Mitra Sahab knows about it. There is a jaundice wala Baba in Chandni Chowk, in the heart of central, walled city. Kalla Saab's very house is very near from there. It's called a place called Chandni Chowk. There is a jaundice wala Baba there. Now he is a tea seller, but on 2 days, that is on Tuesday and Thursday, he sits there and freely distributes a white a green, there is a green leaf which he crushes and mixes some sugar in it and gives to people. And a lot of people come to him on these 2 days and receive his medicine. He doesn't charge them anything for that. He does his gratis, and he's been doing for a long period of time. I think 40, 50, 60 years he's been doing that. Mitra Saab knows about him because Mitra Saab, I think in the childhood, heard about him. But that apart. Now, I thought I should do a study on him. So I asked one of my students to kindly go there and seek his permission and talk to the patient who are coming. So she was able to talk to nearly around 60 patients who came there. And she, because nowadays everybody has got the mobile phone, she also got their mobile number. And I asked her that after 1 month, after 2 months, after 3 months, just find out, what happened, what was the outcome. And I must tell you, nearly 85% of the people who took that medicine reported that they got benefit out of it. So what I'm trying to say is that we have been talking about different pathies, this pathy, that pathy, this pathy, that pathy. And every pathy says, I'm the best pathy. And yesterday I talked about, pathicentrism and maybe, healing relativism, if I may use these two terms, healing relativism and pathicentrism, that is why, widely prevalent. Now, as anthropologists, we can perhaps do these kind of health-seeking behavior studies and look at the outcome that is there. And from that outcome that is there, we can know the worth of a particular kind of a healing tradition. And then somehow, I think in America, people are talking of culture competence, especially in a situation of multiculturalism, multi-ethnic situations. There are anthropologists who negotiate between, if there is a clash between two cultural traditions, and that is what is called as culture competence. In the field of anthropology, this is very popular. Then we have in the field of business that people are talking about cross-cultural management, cross-cultural business, where we are looking at nuances, cultural-based nuances. Similarly, I think the time has come when anthropologists have to play a very, very important role in negotiating between different kinds of pathies and making the task of seeking help by people, I think, easier. Not only easier, but also cost effective. But also, looking at all the factors that Sonia was talking about, affordability, availability, all those factors that are there, and quality, all the factors that are there, which are important for health seeking. I think anthropologists need to come now in the center stage and have to play as negotiators between different kinds of healing traditions, what is called as medical pluralism. Now, medical pluralism is there everywhere. Now, America alone has got nearly more than $40 billion worth of traditional medicines, So it's not only a very small portion that is there. In India also, Ayurveda is there. We have got all different kinds of systems. Even a system like Amchi system of Tibetan medicine would also be a worth millions and millions of rupees in India. So what I'm trying to say is that there is somebody who need to have an interface between all these different kind of healing traditions. And I think medical anthropologists are in a best position to negotiate and to understand by means of, again, I would say that they are the one who are in the best position to do health seeking behavior outcome of health seeking, and that studies are very few there. I think they are not there, apart from maybe health seeking outcome of allopathic system. There are not much data available on health seeking outcomes of other medical systems, which I think is badly needed. And somebody is required who is above all these pathies, who is able to have an equidistance from them, like I said yesterday, and then could intervene in between and save people from unnecessary wastage of their crucial financial resources that they have. So I think I'm very glad that this seminar happened, and many of the people who wrote or who presented papers in seminar, they're all my students. And like I said, that medical anthropology is now in safe hands, and I'm very relieved by listening to all of these illustrious speakers. And I'm really overwhelmed, like I said yesterday, and I would like to thank one and all for these great efforts that were being made. Namaskar.
Thank you so much, sir. It's always pleasure to hear from you, sir. Now I think I will request Professor Dr. Suniti Yadav. So Dr. Suniti Yadav, you are online?
Yes, ma'am, I'm there.
So I request
Dr. Kiran, I just have to would like to intervene. I
Yes.
mean, before vote of thanks, is there anything that we can get a feedback from the participants just before vote of thanks?
Okay. From the chat box, ma'am?
Not chat box also, if anybody wants, they can raise hands. Just give them 2-3 minutes, not more than that. Maximum 5 minutes.
Okay.
If anybody wants to say something.
Okay. So if anybody wants to say something or few words, can you please raise your hand? Or Avitoli?
Yes, I'm here.
Yeah, Avitoli can also read out the chat messages, because in my
Yes.
yeah, chat messages are not visible.
It is visible now. I just stopped for once only, but it's okay. It's here. All right. Shall I read out some chats that are in the that we have received?
Please.
All right. Okay. There is a congratulatory message from Professor Gregory. Congratulations, Professor Joshi, on your illustrious career and your incredible contribution to anthropology in general and to medical anthropology in particular. You are imprinting the anthropological stamp in whichever position you are in. The Indian anthropology is proud of you. I think this particular message sums up all the feelings that everyone present here are feeling. Thank you, sir, for this message. There is one. All right, this is from Dr. Vibha Joshi from Oxford. My best wishes, Professor P.C. Joshi, and wish you a fruitful retirement and wonderful term as Vice Chancellor. I am looking forward to reading the full papers in this wonderful festive. Sir, everyone is like, whoever is typing right now, they're sending message, thank you so much.
There is some Professor Venkatrao's message.
All right. It's more of a comment, but sir, I think I will read out. Professor Venkat Rao, he wrote that in Andhra Pradesh, these days a big issue is going on with one Ayurvedic practitioner giving free medicine for COVID. So many people want to capture his trade. Equal number of people trying to discredit. He's in hide and seek situation. Thousands of people are waiting for the controversy to end. This needs an anthropological study. That is amazing, sir. Thank you. Well, still coming more. I mean, and I think these the messages we have received because we disabled the chat box for some time. Just were popping in when the speakers were speaking, but now it's open for everyone else. So wishes for sir, you may kindly type in the chat box. Thank you. And there is from Professor Sunita Reddy from JNU. Sorry, my internet connection is a little unstable today. Professor Sunita Reddy from JNU wrote, Professor Joshi very well identified the gap understanding the outcome of patients of different understanding the outcome of patients of different pathies will keep in mind in future research. And I'm sure, able, anthropologists like Professor Sunita Reddy and all will take forward whatever Joshi has been doing and has left a mark in all of us. So thank you, ma'am. So there is a message from Professor Mitashri Mitra. She wrote, respected Professor Joshi, we know that you are retiring from one responsibility, but not tired to contribute in the academic and administrative field. Thank you, ma'am, for this message. So far, these are the messages that came in the chat box.
Thank you, Avi. Thank you so much.
So now I request Dr. Suniti Yadav to give a vote of thanks.
Thank you, Dr. Kiran. And it's been my privilege to have been asked to propose a vote of thanks on this occasion, and specifically when we are holding a seminar in honor of our beloved teacher, Professor P.C. Joshi. So I'll formally start my vote of thanks. I am giving it for the first time, so I would ask everybody to kindly forgive me if in case I go wrong. And Saraswati ma'am, please forgive me for anything that I do wrong here. Honorable Professor P.C. Joshi, the Vice Chancellor of University of Delhi, our beloved teacher and the reason behind this seminar, and as Dr. Mahajan pointed, the poster boy for the day. Our most valued guest of honor, Professor A.K. Kalla, former head of the department and retired professor from our department. Our distinguished special guest of honor, Professor I.S. Marwa, retired professor from our department, and to whom we can listen n number of times, and without stopping, we always wish to listen to sir. Our esteemed chief guest, Professor Deepak Behra, and who has probably made it to the Guinness Book of World Records to hold the maximum number of positions as Vice Chancellor of different universities in India. Thank you for gracing this occasion of valedictory ceremony, and thank you for taking out time to be here and mention here your words of wisdom and your words of appreciation for Professor P.C. Joshi, and giving us words of advice as to how we have to proceed in the field of anthropology further. I would like to thank our respected head of the department, Professor M.P. Sachdeva, who unconditionally listened to all our suggestions and who was always there to accept what we decided. So in the seminar organizing committee used to decide and just inform sir. So sir was always thankful in giving us constructive comments and accepting what we had decided. Thank you, sir. I'll also thank Professor P.R. Mondal, the convener of the seminar, Professor K.N. Saraswati, the organizing secretary, for entirely organizing this seminar in such a manner that we could hold all the papers in a timely manner, select our chairs and co-chairs, invite our chief of guests, invite our guest of honors, and invite Joshi sir timely. So I'll thank Professor P.R. Mondal and Professor K.N. Saraswati to coordinate the entire seminar. I'll also thank the co-conveners of the seminar, Professor R.P. Mitra, Dr. Mahajan, Dr. Mitashri Mitra, Dr. Mitashri Srivastav, for being there with us and holding the entire seminar. This seminar is a result of the unconditional love and respect for Joshi sir by his colleagues and students across the country. I would wholeheartedly thank all the respected members who have contributed papers to this seminar. We know the idea behind the fest trip was to honor Professor P.C. Joshi, and I would extend my thanks to Professor Mutatkar, Professor Sachdeva, Professor Saraswati, Professor Mitra, Dr. Mahajan, Dr. Prashant Khatri, Dr. Urfat Mir, Mr. Imna, and Mr. Vineet to put endless efforts in bringing out this compilation of surprise and love for Professor Joshi. Also, a big thanks to all the members and all the members around who kept it as a secret and disclose it only when needed. Also, a big thanks to the faculty members and the non-teaching staff of the Department of Anthropology who were present there during the inaugural session. And the next big thanks goes to Dr. Avitoli, who has been the key person in organizing this seminar in dual mode. Her team, Mr. Arun and Miss Ichi, who were sitting all throughout the day and organizing the sessions. I would also like to extend my thanks to the chairs and co-chairs of the seminar who managed the session so well that the deliberations proved to be successful, and probably the reviews that were received can be incorporated further in the final volume if possible. I would also like to thank the audience for patient hearing and raising questions that could be discussed during the sessions. I can see very eminent anthropologists here on the screen, Professor Gregory, Professor Shalina Mehta, Professor Mitashri, and all other senior members, Professor Senha, and all other senior members who are there, who have taken time out for this valedictory function. Once again, I would like to extend thanks to all, and I would extend my apologies in case I missed any names. And thank you very much for being there. Over to you, Dr. Kiran.
Thank you so much, Dr. Suniti. Now is the end of the 2 days national seminar in honor of our sir. So I thank all the participants. I thank all the senior professors and faculty members and everyone. So thank you very much. And it's the end of the day. Tomorrow again we'll meet at 10 o'clock. So bye-bye.
Thank you, Dr. Kiran. Thank you, everyone.
Dr. Kiran and Dr. Sachdeva sir, if you permit, I would like to send one sentence only. I was directed by Abitoli to announce that tomorrow is a grand farewell, and all those present now, please be there tomorrow with us. That is my request. Thank you, sir. Thank you.
Thank you, Professor Behra.
नमस्कार प्रोफेसर
नमस्कार सर, नमस्कार सर।
बहुत अच्छा हुआ आपके प्रोग्राम, बहुत अच्छा हुआ।
Thank you so much, sir. Thank you so much.
Good evening, Behra sir. Good evening.
Good evening. Congratulations, ma'am.
Namaskar.
Namaskar, namaskar, sir.
Now your background is giving the real look.
मिलके करेंगे सर, और कल तो फिर हम ज्वाइन करेंगे। तो I've been following this program, and you, Professor Sachdeva, you need to be congratulated for doing great job.
Thank you, sir. Thank you so much, sir. My department people are great, sir.
Yes, yes. Each one is unique.
Yes, sir. They are highly talented, very resourceful.
Yeah.
Congratulations, sir. All of
Good evening. Good evening, Madam Mitashri, Madam. Good evening.
Good evening.
Ma'am, namaskar.
Namaskar, sir.
Namaskar, ma'am. Sachdeva here.
Congratulations to all, sir. And we expect that 2023 will be a great year for all of us. Thank you, sir. I'm not keeping well, sir. That's why not. Bye, sir.
Okay, bye. Namaskar.
Namaskar.
Over to Dr. Abitoli now.
प्रोफेसर सरस्वती,
Yes, sir.
कल का प्रोग्राम जो है किसके पास फाइनलाइज वर्जन है?
No, it is with me. I'll send you right now. It is sent to everybody. I'll send it to you right now. Yes.
कल का जो भी डिटेल ना, प्लीज मुझे फॉरवर्ड कर देना। कल्ला साहब, नमस्कार सर।
Namaskar.
Good evening, sir. Nice to see you, sir.
Send you. God bless you. How are you?
सर आप कैसे हैं? सर
बिल्कुल ठीक हूँ. I'm fine. Send me also the information about tomorrow.
अभी भेजती हूँ सर. अभी WhatsApp
अभी सर भेज देंगे सर।
और विभा कैसी हैं?
I'm good. I'm well. It was so nice. Thank you for sharing the information about Professor Joshi's Festschrift and the conference. And I'll be there tomorrow.
For sure.
And so nice. And congratulations for being VC.
Professor Bimaji, namaskar.
Namaskar. Deepak, you have already got
It's so nice to see my former teachers and my colleagues. So it's really nice.
Thank you
feel
so
like-
much for being here today, and tomorrow also we expect you. Please be there.
Yes, yes.
Actually, what she's sharing tomorrow's program, sir. Abitoli.
Okay, it's all right.
But anyway, I will send you. Yes, sir. Yes.
ये जो कल का प्रोग्राम है ना, जो हमारे गेस्ट फैकल्टी उनमें प्लीज शेयर करना होगा, जो गेस्ट फैकल्टी है ना हमारी।
नंबर मेरे पास नहीं है सर, मैं आपको कर दूंगी, आप कर दीजिएगा।
हाँ, या हाँ मेरे को कर दो, मैं फिर राजीव के थ्रू करवा दूंगा।
Sir, I have with me. I will say.